On March the 3rd, China made a massive claim. The country declared that of the tens of thousands of armed forces personnel deployed to fight the COVID-19 crisis, not a single service member had been infected. In the weeks since, evidence of China's less than transparent handling of crucial COVID-19 data has compelled analysts the world over to scrutinize the country's claims more closely. And the claim about zero infections in the People's Liberation Army ranks is the latest to be put to the test. The result? It is very likely a tall claim, if not an outright lie. A brand new report by India's independent research think tank, the Takshashila Institution, says that the Chinese claim is likely very far from the truth. Taking the assertion that has been repeated by the Chinese government several times since, the report concludes that China's claim does not stand scrutiny. It goes on to say, at the bare minimum, the PLA would have experienced around 80 confirmed COVID-19 cases among its medical staff.
In terms of our reporting, we looked at the PLA specifically, and what we found was that clearly the numbers have been underreported because the Chinese authorities have said that there was no infection among the PLA ranks throughout this period. And the PLA played a very significant role in all of this, right? They were involved in terms of medical care. There were PLA doctors involved. They built a hospital in Wuhan. In fact, they built supply chains, they maintained supply chains. So there was lots of work that the PLA did. Yet the fact that not a single personnel was infected seems fairly dodgy.
Even more glaringly, the report says that the actual number of COVID-19 cases in the Chinese armed forces could be much higher than 80 if one were to include installations that are located in the Hubei province. The military units deployed in Hubei province that houses Wuhan include an air defense brigade and an airborne corps of the PLA Air Force.
If we were to look at the sort of base level case, the bare minimum caseload, and just look at the number of doctors that were infected in Wuhan and Hubei, what we realized was that in terms of official numbers from China, around 2,600 infections took place among civilian doctors in Wuhan and Hubei. Now, if you take a percentage of the overall doctors employed in Wuhan and Hubei and the number of doctors infected, and you apply that same percentage to the PLA medical personnel involved in Wuhan and Hubei, you get a number of around 86 infections. So that's at least the bare minimum that should have happened.
China's very telling lack of transparency in reporting COVID-19 data is reminding observers of similar claims made during the 2003 SARS outbreak. At that time, China's claims were debunked by the World Health Organization itself, which confirmed that approximately 8% of all SARS cases reported in China were among military personnel. And the number of personnel deployed to deal with COVID-19 at approximately 560,000 is far higher than the number China deployed for SARS. Another crack perhaps in China's wall of dishonesty. Bureau Report, India Today.